Thank you for tuning in to Not Just Girl Talk with Tiffany and Ashanti. Make sure you got a beverage in your hand. Sit back, relax, and engage with us. Thank y'all for tuning in to another episode of Not Just Girl Talk. I am your host, Ashanti.
And I'm your host, Tiffany.
And as y'all can see, we have a special guest today. We're going to give her a proper introduction, but she's going to just let y'all know her name right now. Let them know who you are.
My name is Tracy Miller, and I am great friends with both of these beautiful young ladies.
Yes, we are excited to have you on our show today. So y'all already know before we get started, Tiffany going to let y'all know where you can tell a friend to tell a friend to tell a friend where to find Not Just Girl Talk.
Yes, of course. We want you guys to follow us on IG at notjustgirl_talk. Again, that's IG at notjustgirl_talk. Also, we are available on Facebook at Not Just Girl Talk with Tiffany and Ashanti. Again, that's Facebook, Not Just Girl Talk with Tiffany and Ashanti. And then, of course, our YouTube at Not Just Girl Talk Podcast. Again, that's YouTube at Not Just Girl Talk Podcast. And we're in the Twitter universe at Not Just Girl T, at Not Just Girl T. And lastly, our blossoming is what we're saying, our blossoming TikTok account. We will be posting TikToks this week. Blossoming TikTok at Not Just Girl Talk Podcast.
Yes, make sure y'all tune in. Like I said, tell a friend to tell a friend to tell a friend about Not Just Girl Talk. So, beverage of the day. Before we get started, y'all already know we like to have something in our hand to sip on. We want you to have a beverage in your hand while you're listening to us. So, Tiff, what you sipping on today? What you got?
I am sipping on a little pink Moscato. Simple. Just a little light.
Tracy? And dude, it ain't because what you got? Normally Tiffany fills her glass to the top. You know, she's been modest today.
My glass is filled to the top. My cup, rather.
What you got?
I have green tea kombucha. This is a yogi tea. This is an organic green tea. Little kombucha, good for your digestion and your immune system.
Oh, okay.
Push my alcohol.
She got her alcohol. Well, today I am sipping on, it's a sparkling, y'all know I love my sparkling, but it's just a sparkling juice. Actually, I do not have any liquor today. Tiffany is the only alcoholic today. So.
It's okay. It's okay. One drink a couple of times a month. You're not an alcoholic, Tiff. Don't feel bad. Don't feel bad.
It is fall break.
Yeah. Okay. You know what? That's it. It's fall break.
We should drink to that, guys. It's fall break.
Yes, drink to that. Tiffany fall break.
Bam.
Okay.
Yeah, I like that. So y'all let us know what y'all sipping on. She got the bottle. The bottle is next to her.
I'm done.
It's for refills. It's for refills.
You got it. You know me.
Because it's about to get good. You know what I'm saying? Sometimes you already know.
Yes.
I just need to have my refills over here.
Exactly.
Tiffany on break. Okay.
Yeah. And my birthday's in a week, so we're trying up to that too.
Exactly.
Yes. Happy pre-birthday.
Yes, pre-birthday.
Yes. So moving into the show, y'all want to catch up on our weekend. Let us know kind of what we've been into, what's been going on. Tracy, since you're our guest, we'll start with you. What you been doing this weekend? Anything exciting?
So this weekend, I did something exciting. If you would have asked me this last weekend, I would have been like, nothing. But yesterday, my friend took me for my early birthday gift. Tiffany, you remember we were supposed to go to New York to the Lights On Fest. Yeah. And girl, they canceled it. They canceled it like on that Monday. They just like made a post, and I was like, no. I was looking so forward because I love her and I love SWV. They're supposed to be performing, but yesterday we had it's actually was yesterday and it's today too, the One Music Fest. So I got to see her yesterday. I saw SWV. Ty Dolla $ign, Young Dolph, Crime Mob. It was fun. So it was like an outdoor concert. So you bring your like your towel, and they had like food trucks, and you could get like shaved ice and drinks and stuff. It was nice. It was fun. It was a whole vibe.
Oh,
but you see, when you said crime mob, everybody else was like, crime mob. You see us
yes, Memphis. Memphis is Young Dolph, but yeah, that was Atlanta right there. Crime mob. It was fun. Scrappy, all them whatever. It was cool.
Oh wow, that sounds like a real nice concert.
It was nice.
And outside, okay.
Yes, the food was good. It was good. It was nice.
Okay. So what you had going on? What you had popping?
Well, I'm officially on fall break. However, my county, Aaron was on, or my oldest was on fall break this previous week. So I felt bad because I am not on fall break to this week. And so our kids had Monday through Thursday in school. So Friday was a teacher work day or professional development. But I was like, you know what? That's the start of my fall break. So I took them to the aquarium in Chattanooga. And then we just came back because it's not far from us. And then we took them to Gaylord, got a room last night and spent the night there. We went to the water park in Gaylord.
That's nice.
So they had a good time. Aaron,
you gotta post more. I feel like I don't know what's going on. You'll be posting. I need
help. I need an assistant.
That would have been perfect. Like, I don't know, what is Tiffany doing? I mean, I gotta watching people's stories is how you know.
Well, I can still do it, right? I can still.
We took pictures. Can do it.
We got pictures. Yeah. So that's my whole weekend.
Okay, so apparently Tiffany needs an assistant.
Yes.
Post her personal pictures.
Yes. We'll work on that. We'll work on that.
Oh my God. So what I have popping? I think I'm always busy with 4 children. So this weekend it was interesting. Fat, he had his homecoming. So it was his homecoming weekend.
How old is he?
He's 17. Well, he's gonna be 17. I know.
17?
17.
Oh, yeah. The last time I saw him, he was like,
yeah, no, he's gonna be 17. Yeah, so 17 homecoming game. So he couldn't play in the homecoming football game because last week the lineman, he had just gotten the game excited. The lineman rolled over on his ankle. So he was out all this week. He was kind of sad he couldn't play in the game. But everybody went to the game. Yesterday was homecoming dance. Now, when we was in school, we just went to the dance right after the game that Friday night. We didn't have like a dance per se. So, I mean, we did, but not like this. So now
it was in the school cafeteria or gym.
It was like we just went straight up. That was it. But no, it's different. So he had a date to a homecoming dance, and we met with the young lady, like all the friends got together at somebody's home outside in the backyard. They had food for the kids to eat. It was literally in walking distance from the school. But we had to get him an outfit. He looked real nice. You know, he was dressed up with his black on black, his button down, his little nice shoes, his dress pants. You know, he came through stepping. Yeah. So he thought he was looking too good. If I can't remember, y'all, for YouTube, if y'all watching us, I would try to put a picture in of him, you know, out kind of so y'all can see what he looked like or online. But yeah, he came through stepping. And then after homecoming dance last night, it was an after party. I let him go to the after party. And the after party went over. So I picked him up at like 12:30, 12:45. These kids was partying until 2 a.m. Where's my high schoolers?
Wow.
I said, I don't know nobody. I don't know where they do that at. But you coming home. I'll be there to pick you up between 12:15 and 12:30. We're going to continue. We're going to pick you up. But I was like so dog tired driving back home. I was like, let's get home, get into bed. I said, I done got old. I'm about at 12:30 at night. Pick us up.
At least he don't make decisions like us.
So don't feel
bad. Don't be like us, Sean.
I go super early.
Shoot, Sean,
That's what I'm saying. So I'm out at midnight picking him up. I'm tired as can be.
You talking about 12 or 12:30 though. You know, we booked the system. Like, well, we already in trouble. So remember that.
We did. We're supposed to be home at 12. We was like, well, we already in trouble. Might as well
Like, might as well.
Keep it going.
Man, I was in trouble. Like, don't follow that, y'all. I was in trouble.
We got in trouble. We back to Tiffany house. Her mom was like, y'all think y'all grown coming up in here? It had to be about 1 something in the morning. Like, it was late.
It was bad.
Yeah, it was bad. We was like, we already in trouble. So,
but stay out a little longer.
But they had a good time. It was nice this weekend. So the kiddos, we had football too, but that's normal every weekend. Yeah. But yeah, so it sounds like everybody had a good field weekend. We all did something. Yeah.
Yay.
So what we got next? Okay, so we're gonna move into our next segment of the show. It's called Sip on It or Speak on It. Tiffany, what you got for us today?
A sip first.
Okay.
Oh.
Ciao. So, sip on it or speak on it. So this week I saw this nurse in Florida has apparently posted. So let me say this. I think it's a difference in generations. I'm going to start by saying that because I feel like at this point, these babies are getting online degrees or so. I don't know. They not putting in work. I don't know. But this child, it just came out of nursing school and decided that she was a NICU nurse, that it was appropriate to post someone's child on social media. And the child was born with a medical deficiency where the intestines were born outside the body. Of course, they had to be have surgery and have it put back in. But she was making fun of the baby and posting pictures on social media. So I'm offended and I sipped first, but I'm definitely speaking on it because had that been mine, it would have been Franklin Memorial Hospital after I dragged her.
Oh, yeah. But this
is
my hospital now.
Yeah,
for sure.
And I would have dragged her through my hospital. Okay. Yeah. So what y'all think about that? What is,
totally unacceptable.
And she was fired, but they put her on leave at first. That's no, immediate.
Yeah.
And they said she just graduated. You need to, I don't know, what school you went to? DeVry? I don't know.
Yeah. Not acceptable.
Let me stop. Keep going. But
didn't they close DeVry, y'all? They closed.
Probably.
It's over.
She went to Trump University. I don't. I'm sorry.
I'm upset that she didn't put a baby on social media. And then, first of all, I'm pretty sure she had to go through school and to be a NICU nurse. A lot of people try to get into that area of nursing that I've heard as far as dealing with babies and want to be in that space. So I'm pretty sure she worked hard to get there, to have it all taken away for a picture.
I don't think she worked hard is what I'm saying.
If she got hired, she got the degree. Now the intelligence.
This word of COVID, nurses are short.
Book smart and street smart. Book sense and common sense. They don't quite mesh well. So she probably got a lot of book sense, but that common sense went out the window when she took that picture. Just trying to, and then people doing so much just for likes, just to be in the know. You know what I'm saying? Just to be, and you're gonna jeopardize your future.
Yeah, it's not that serious at all. Yeah.
Your job, your future, your training, your schooling, your money, because you pay for that school to be a nurse, and you dealing with babies.
Yes.
Yeah, that's one field, or even nurses in general. But this is a child, so that makes it that much more worse. You know what I mean? And I feel like labor and delivery, NICU, those are sick babies. You know what I mean? Neonatal nurses should, be compassionate out of all. All nurses are compassionate, but I would think even a heightened sensitivity or empathy for these parents and children.
Babies. Yeah, that's disgusting. Well, at least she was able to get out of the field by showing her true colors now rather than later. because you never know on down the line how she treats somebody's child. Just because if you making fun of a baby born like this, who knows what you've done?
Yeah, but they didn't say. They said she got terminated, but I don't know that she lost her license, so she may, still
Oh.
apply somewhere else.
Yeah, she may have to go sit before the board or something.
Yeah.
Yeah,
So,
I definitely think.
Mm.
yeah.
Well, I'm gonna speak on that, but I'm gonna take a sip too
I'm
for
telling
her.
you, you just need something. Well, yeah.
Because that don't make sense. I'm quite upset about that. I'm mad for the mama.
Yeah.
But yeah, that's ridiculous. Okay, let us know what y'all think about our topic. You sipping on it? Put your glass in the comment, and if you speaking on it, put your comments in the comment section. Let us know how you feel about this situation. So yeah, we're gonna jump on into the topic of today. But before we do so, I'm gonna let Tiffany introduce our guest to let y'all know how we're gonna, maneuver with our topic of discussion. It's so befitting to have her here. So Tiffany's gonna give her a proper introduction. Tiff, let them know about Miss Tracy.
Yes, yes, yes. You guys, we have Miss Tracy Miller on the panel with us today. She is awesome. She's my sorority sister, uh, one of my best friends, and she's also a nurse practitioner in women's health. So we're going to be talking to her about some questions or getting her to answer some questions. And lastly, she's also a breast cancer survivor. So it's befitting for us to wear our pink and honor her, but we want you guys to hear her story and while hopefully giving you guys formal or appropriate information on women's health. So Treecie, welcome to Not Just Girl Talk.
Thank you. I'm enjoying myself already. I'm having so much fun.
Good. Thank you. We're so appreciative for you to take time out of your schedule and sit down
Yeah.
and,
Yes.
chat with us. And our
Yes.
topic focus of today is pretty much women for us to get to know our bodies.
Yes.
Um, and how that is pretty important to us. And if you could tell them a little bit of your journey and how important it is for us to pretty much know our bodies in different areas.
Very important. So well, thank you, number one, both of you for having me. I feel honored that y'all thought of me to do this. I think I'm gonna say next year will be 10 years that I've worked as a nurse practitioner in women's health. So excited about that. But I'm thankful for my background because I think me telling women the same thing every day it kind of is a reminder for me. Granted, I didn't do like my breast exams every month, like I tell my patients to, but that's usually why I tell my patients, like you go yearly for your annual, and I've tried to try to make it a thing for my patients to help people remember this could be something good that your listeners can try to incorporate within themselves as well. Like around your birthday, like you're getting older, it's another year. It's like that could be your reminder to prompt you, like, let me make my appointment for my annual. Every year around my birthday, let me go do my annual. So every time people come for the annual, that's where we do your complete physical, head to toe exam. We're doing your pap smear if it's time for that. Pap smears are every 3 years if they are normal. If they're abnormal, you just follow our guidelines, whatever we tell you to do. But typically they're every 3 years, but you still need an annual every year. You want a professional checking like your blood work, doing like your cholesterol, diabetes screens, your STD screens, um, doing your physical exam, all of that good stuff. So, like I said, I usually tell my patients every time when I'm doing their physical, I'm teaching them how to do their breast exam. As I'm checking it, I tell them how to do it, which is, I always tell people either have your arm behind your head and you can lay down on the bed, or like if you're in the shower, you just put your arm up and you're checking the lymph nodes, which start under the arm. So you check from there. And then I usually tell people to check from the collarbone to under the breast. So that's all your real estate. So a lot of people forget, but these are lymph nodes here where your clavicle bone is here. So from the clavicle to under the breast, and then underneath the arm. And then I like to, some people do a circular motion. They just go around, around, around until they get to the center of the nipple. Or I like to do the zigzag pattern where you just go up, down, up, down, up, down until you cover the whole breast. You do that at least once a month, because you only come to see me once a year. So a lot can change in a year, especially depending on the type of cancer. Sometimes cancers can grow very rapidly. So you may get your breast checked in October this year and something could pop up by January. And if you wait until your next annual in October, a lot can change from then. But I wasn't really checking my breast every single month, but I just happened to be checking my breast. I was like laying in the bed. I was visiting my sister. It was around like Valentine's Day in 2018. And I was over at my sister's house. I spent the night and I was getting up. I was going to church that morning, then I was going to drive back to Atlanta. And I was laying in the bed and I just happened to check my breast and I felt something on the right side, like right on the side of my right breast. And I was like, like this doesn't feel normal. So typically, like some people can have like cysts, which are like just round. It almost feels like a marble, and it's very distinct borders, and it moves around. Like okay, so not anything too alarming. But when I felt it from my training, I knew I was like, oh, this doesn't feel normal. The borders were irregular. It was kind of like a little paint splatter. You know how it just looks like like that. That's how it felt. And it was a knot. It did not move. Like it wasn't like you could play with it and it would move around under your fingers. It was like fixed to my breast tissue. And I was like, this does not feel right. So I used to work with a breast specialist. She used to rent office space in the building that I used to work for. And immediately next morning, when 8 o'clock hit, I was like, Dr. Speed, I need to get in. I need to come see you. I found something. She got me in. I want to say like the next day, they did my biopsy. And the following week, my results were back. I had stage 1 breast cancer. I was HER2 positive, estrogen and progesterone negative. So I had to get surgery. I only got the mass removed. So that's called a lumpectomy. I got a lumpectomy. And then I had to do 6 rounds of chemotherapy along with Herceptin. That's the drug that's targeted to kill the HER2 receptors that cause the cancer, or rather turn them off. We all have HER2 in our body, but mine were just overproducing. And then, so I had to do that for like a whole year. Lost all my hair.
Oh, wow.
Yeah. Everything. Yeah. So that's what I was going to ask. That's a journey. I'm glad that you are a medical professional, so you know what's normal and not. So I think some of us, me, I don't necessarily, like you said, I don't check my breast every month. I know that's probably what we're told to do, but I just don't necessarily do that. But because I think your training, you knew what was normal and what's not. And I think, especially us as moms, sometimes we think we put us maybe last, kind of like, oh, this is normal. When I get around to it. Like you said, if let it go too long, it's something that could spread. But what was the toughest part of the journey, finding this out? What would you say was the toughest part for you?
As vain as it may sound, losing my hair probably was one of the worst like physical things, because my hair has always been my thing. I have it now, but like it was gone. Like you lose all of your hair. I don't know if people just think like, oh, you do chemo, like you're gonna lose the hair on your head. Every ounce of hair that you have on your body, eyelashes, pubic hair, underarm hair, leg hair, which are good, I ain't gonna shave no more. But your eyebrows, your eyelashes, you don't realize how important those things are to have. Like that prevents stuff from getting in your eye. Like your eyelashes are there for a purpose. Your eyebrows are there for a purpose, to protect your eyes. And so you don't have anything. Like it's just crazy. Like you don't have anything. So, but yeah, I would say that because, and partly because like my hair was like a big part of my identity growing up. Like I've always had like really long hair. Like
Yeah.
my hair almost like been in my butt pretty much whole life. Within times like I may have gotten it cut or something, but it was like a big part of my identity. So I would say like physically, like wise, like that was a big impact. And you don't realize like it does a lot, like granted, like people know, yeah, you're going through cancer, but it's still like you're still very self-conscious, like I don't
Yeah.
have any eyebrows,
I didn't even
like
think
you're having
about
to like,
the eyebrows or
girl, like
like I
nothing.
never thought about that part. Just
Ashanti,
I
nothing,
only
no nose hair. Like so stuff can just like
oh
you realize like
wow.
God designed us like this for a reason. Like you're supposed to have nose
Mhm.
hair so stuff doesn't go up in your nose. You're supposed to have eyelashes so
Right.
stuff doesn't fall in your eye. And it's like, oh, it's not just to look cute. Like you need you need this stuff. But
Right.
I mean, then I had to like look at the bright side. I'm like, oh, I'm glad I don't have to shave. Like
Well,
like I didn't have
hey,
to shave. Everything was just nice and smooth. But I would say that's probably one of the hardest parts. Um okay, yeah, I was about to keep talking about the best part, but you can ask me that. So
It's
I
okay.
do that.
well, I
Yeah.
was gonna
Well,
say,
that's a
which,
good.
go ahead, Sean.
Okay. Well, um, hair. We see like your hair is looking good right now.
It sure is. It's popping. Your
You.
curls
Thank
popping today.
you. Thank
So,
you.
so even though you went through it, it came back. It looks good.
Thank you. Thank you,
Yeah.
Ashanti.
So I did have a question. First, I
Yes.
want to say, definitely thank God that you overcame. You are a survivor.
Yes. Thank God.
We definitely thank God for you being able to come out on the other side. My grandmother, my dad's mom, she's a breast cancer survivor. My granny,
Yay.
yep, she had breast cancer and she's a survivor of breast cancer.
Yes. That's so good
Um,
to hear. I love to hear
yes.
survivor stories. Yes.
Yeah. So I have a question for women's health. So we're wanting to kind of get to know our body. So my daughter, she is how old is she? 13, and so
Yes.
she's already had her, cycle and things like
Uh-huh.
that. I want to know from the medical side, do you all prefer? Because they have the new cups for the
Yes.
cycle,
Uh-huh.
and then you have tampons and you have the
Mm-hmm.
pads.
Mm-hmm.
What is the more likely preference? Like, how do you feel about this new cup? Have you used it?
I think the cup is a great idea. Because it's
Oh, okay.
silicone. I think one of the most important things with any of those options is I would highly recommend using an organic tampon or pad, or the cups are good because they're silicone. So all of those materials are good for your body. A lot of people don't think about it. When people say you should be organic, you just think about your food, but that also means what you're putting on or in your body. So conventional tampons and pads, everything, all of it has cotton, has soft and it's white. If they're not organic, it's just like food that you would buy at the grocery store. They're spraying that cotton with pesticides and chemicals that when you put it on your body, if you're putting that pad near your vagina or you're putting a tampon inside, your body is absorbing all of that. It's getting into your
Oh,
bloodstream. That can affect your hormones. It can cause hormone imbalances. Certain pesticides have been linked to certain types of cancer. So I think uh, for a young lady, I would suggest probably if unless they're an athlete, I would say just start with organic pads.
okay.
But if like they're an athlete and they're really active, um, maybe start with the organic tampons first because the cup is a little bit bigger.
Okay.
Um,
You froze up on us a little bit.
Tracy. She, oh, can you hear us?
Okay,
You
there we go.
froze. There we
There we
go.
go. You
Froze
just
up.
froze up
oh,
a little bit. Yeah,
oh,
it's
did
okay.
y'all hear? What's the
Yeah,
last thing I heard? Can
The
you?
last part was the cup is a little
cup is a little
bigger.
bigger.
The cup is a little bit bigger, so you may I would say maybe wait to use the cup. But you know,
I
whatever
wonder
the
how this cup thing
lifestyle.
work. I don't have a cycle, so
Whatever. So I mean, so I'm not hating.
Oh,
I
that's the
am.
other thing that happens when you go through chemo. You stop having a period. I didn't have a period for a whole year.
oh,
Because it disrupts your hormones. That's one of the other things. Chemo can kill your eggs. So you are born with all the eggs. Like as a
Mhm.
baby, you are born with like hundreds of thousands of eggs,
Mhm.
and every time you ovulate, when you have your period, when you have your cycles, like you're losing those eggs. But when you go through chemo, it kills those eggs. It disrupts your pathway to let you know that you need to have a period. So you don't have a period at all while you're on chemo either.
did it come back?
Yeah, it came back. It came back. It did.
Okay,
Mm-hmm.
Yeah.
okay. Oh wow, it's a lot that happens. I don't
Serious.
even
I know they don't tell you these
don't
things,
think about
girl.
it.
Yeah, I just thought it was
Yeah.
the hair on your head, girl.
Mm.
Everywhere.
Well, hey.
And I had a second follow up question to that. Okay,
Yes,
so dushing. I think me and Sis was kind of thinking.
absolutely. Never,
Can't
ever,
even get it out.
never, never,
Oh,
never. People are like, but they make them. So
I
quit
know.
trying to make money. But no, never,
Feminine
ever.
washes.
I'm not even a fan of feminine washes, honestly.
Hmm. Those yoni
I
ball, the yoni pad, the little yoni thingies that they be put. Okay.
people come to me all the time after they do their little yoni pearls and stuff, and they're like, ever since I did that pearl, I'm not right. Yeah, they put all that. I mean, I just the the most simple way to describe it, like your vagina is a self-cleaning oven. Everything that needs to come out is going to come out on its own. Even so, I've learned in my almost 10 years of practicing, you have to be very specific when you ask people questions. Not even when you wash down there. Sorry. Not even when you wash down there. Don't go inside of the opening. You're just washing in between the folds, but never go in there with the towel and do like that. That's also considered a form of dishing. But your vagina has a certain pH that it should be. Your vagina is acidic. If you're looking at a pH scale, um, your vagina is acidic. So if this is acidic and this is
A base.
basic,
Mm-hmm.
say you just put water in there. Water is neutral. Water is right here. So if you
Mhm.
put just water, if you're like, I just only use water, you only put water in there, you're going to bring your pH balance from here, where it should be, over to here. And when you shift from over here to over here, bacteria can start to multiply and thrive over here. And they can't when in the acidic environment. So when you do something like just putting water in there only, or using like some type of scented product or douching and whatever product or anything like that, it can affect your pH balance, and then you get what we call bacterial vaginosis, and that's when you come see me and I get to prescribe
Yeah.
you antibiotics.
She just said it so nicely.
Yes.
No dishing, people.
No
Okay, don't
douching.
put.
So
No
y'all
douching.
heard it.
And
Y'all
it's
heard it
other
here.
things. Let me tell you this. A lot of people are like, I get this a lot of times too. People come in there like every time after I have sex with my boyfriend, or it happens often, like I I get bacterial infections. Semen is not acidic like the vagina is. So if some people say, like if he just ejaculates inside of me one time, it doesn't happen. But if he does it 2 or 3 times, like, I notice like I'll get bacterial vaginosis.
Mhm.
It could be because that pH balance is shifting from here to over here. So sometimes some people are more sensitive to it than others. So they may have to, be like, hey, can't do that every time. But then you run into
Okay.
problems. Some people like they might maybe trying to get pregnant. And so they're like, well, he has to, so but
Right.
just food for thought. Yes.
Oh, that's a good
So
segue. That's a good one. When I was talking about the cause she's saying when you with your spouse, and I had a question about condoms because I heard condoms, certain condoms can throw
They
off
can.
your pH balance.
They can. Certain ones can. So read the label and make sure, like, because some of them come with like lubricant inside, or like the ones that have flavors to them and stuff. You know, like when you start getting into stuff like that, those probably definitely are the ones that would affect your pH balance. Some people have latex allergies and they may not even know. The next best thing, if you can't use latex, is polyurethane. So I would, it protects against everything just like latex. But if you have that allergy, or if you feel irritated every time after you use a condom, I would say try to switch to a polyurethane condom. Skin, SKYN, is a brand that is considered a polyurethane condom. You could try that.
See, I almost said, what's that word? But then you gave me the brand. So
yes.
So I was like, what?
Polyurethane.
I know poly means multiple or many.
Yes.
But but yeah, I'm like,
bring it out. Bring the biology out.
Yeah. Well, I teach science now, but
so
I don't know everything though.
Yes.
So I had a couple of questions too, Tracy.
Okay.
So I know you kind of answered this. And I guess I'm going to ask from an insurance purposes. I know you said that if pap smears are normal, you have to come every 3 years. I'm of the preference of I want to come yearly. Could y'all still? Still do it?
It depends. It depends on the provider. Some people are really strict and they're like, nope, the guidelines don't say it. I'm not going to do it.
Yeah, I'm about to get a new one. And so I hope she,
you have providers that are like that. Insurances aren't completely hip to it now. Insurance, a lot of insurances for the most part will still pay for you to get it once a year, but from a clinical and research standpoint, unless like you have like multiple sex partners, or you have a new one or something and you have concerns, like you don't have to, if they're normal, you don't have to get them every year. But from an insurance standpoint and payment wise, a lot of insurances still will cover it once a year, but it depends on the provider. Some providers are like, no, based on the science, you don't have to have one every year, and I'm not doing it. So providers are like, okay, if you want it, I'll do it, so it just, I think it depends on the provider. And also some insurances, I think, have updated their policy, so they may not pay for it. If you're cool with paying for it out of pocket, if your insurance doesn't cover it, cool.
Nah. Now, see, the thing is, I know they're saying research and all of this. I mean, wasn't it at one point, what was the recommendation for mammograms and stuff? Because I'm seeing more and more women younger. Like, how were you when you were diagnosed exactly?
I was 33 when I was
33.
Diagnosed.
So what was the recommendation though for mammograms and things?
40 is when you start. Unless you like have a direct family history of breast cancer, it would be 10 years before that person was diagnosed. So say you had a mother that was diagnosed with breast cancer at the age of 40, you would start getting your mammograms at 30, 10 years before. But
see, I think that, I mean, I get research and all of that, but some stuff I think, and you're not the only person that I know that is just getting, breast cancer younger and stuff. So I don't know.
Yeah.
I think that research should be shifted.
I think that's the big thing with, as far as the breast, you checking your breast yourself.
I know.
Would greatly help with that. And like I said, if I didn't check it, it could have been a long time. But like for cervical cancer, for example, cervical cancer is a very slow growing cancer. So the research that the reason why it's every 3 years, they found that they were doing more invasive and aggressive procedures on women that were unnecessary. Majority of like HPV, your immune system can fight it off. So they were finding like they were doing like these painful procedures on these, well, not necessarily painful, but just unnecessary procedures. Like they would be getting it every year or every 6 months, when you had given yourself time, it was going to go away. Now it's very slow growing. So if we're looking on a scale from like 1 to 10, this is how I always explain it to my patients. So let's say somebody comes in to have an abnormal pap smear. 1 is normal, 10 is cervical cancer. So the research that they did, they found that it takes a very long time to go from 1 to 10. So if someone comes in, they have an abnormal reading, and I'm telling you, come back in a year, because we don't want it to go from 5 to 6 to 7 to 8. The problem becomes if you have a pap smear and I'm like, come back, we need to do this procedure. And you're like, I'm not listening to Tracy, and you don't come back for 9 years. We miss steps 4, 5, 6, 7, 8. Because there's a lot of things we can do to prevent you. My doctor that I used to work with, she said, as bad as it sounds, she was like, if there's a type of cancer that I had to have in my lifetime, it would be cervical cancer, because it's the most easily treatable, preventive type of cancer to have if you catch it soon enough. So if you're
And
following
that's
the
what
guidelines.
actually my grandmother passed from cervical cancer. My mom's mom.
Yeah.
Do you
Yeah.
know
She,
she
but
Well,
getting like her
she
screens
gonna
and
she
stuff?
say,
wasn't. She told my mom them when she was in the hospital. She was like, make sure you all go get your exams. She
Yeah,
was like, that's something that she did tell them, was make sure you take
because
your
I
exams,
will
make sure,
say,
because she didn't like the doctor's office. Like she just, some older generations, they just didn't trust
yeah,
the doctors, and it was kind of
yeah,
understandable with their generation of maybe
yeah,
how the women were treated in the medical area, but she did tell my mom that make sure y'all go get checked up. Make sure you go to the doctor. Make sure you see what's going on with you. Yeah.
yeah,
So that was something that she definitely told them to do.
yeah. Whew. So,
yeah.
let's,
I will say that a lot of the like cervical cancers that I've seen that are more aggressive or more advanced, when you find out is when people aren't coming on their
Hmm.
their
yeah,
routine. Yeah.
yeah,
Yeah.
But obviously, like if somebody has an abnormal reading, we want to see you more often than every 3 years.
right.
Like we want you to come in and all that good stuff
Yeah.
more frequently, but not 3 years. Like, you're not going to have to wait 3 years.
Yeah.
So, what are some things? Because I've had an abnormal pap before, but what are some reasons a pap would be abnormal?
Typically, so a couple things like just inflammation alone sometimes can make you
Mm.
have an abnormal reading. That's typically something called ascus, atypical squamous cells of undetermined significance. Ascus,
See, look, I know what squamous cells are because
I was
AMP,
like, that was a big
AMP.
word. That was medical
yes,
I knew what
terminology.
it
yes.
was. I'm with
So
you.
that's why we call it ascus. It's just real easy, ascus. Okay, but ascus typically like any type of inflammation. So let's say like the day you come in for your pap smear, if there's a little yeast, a little bacterial vaginosis going on, if there's some type of STD going on, like not saying
Yeah,
that that's what you had,
yeah,
like chlamydia, gonorrhea, trichomonas, anything that can cause inflammation, or just say like you just had sex like the night before your pap smear, and like the friction caused inflammation there, and you come in and we do your pap smear, like the inflammatory response can be going on when we take our swab. And please, y'all, we're not cutting. We're like, she went in there, she clipped something. When we do your pap smear, we're not clipping. It's a little swab, and we're just going like this. Girl,
It do feel like y'all be clipping. I ain't gonna lie. It's like y'all be pulling a little
it's a
skin
click.
out.
no,
It's the click.
there's nothing pulling. I promise. I'm not cutting anybody. Okay. Not
You know
cutting
what
anybody.
it
It's just a little
do?
swab. I think when people hear the click, they're hearing the
Yeah,
speculum when we open it.
yeah.
It goes click, click, click when we open it.
No, it's like
Sometimes
y'all put like a little grabber. It's like snip.
I'm not gonna.
there's no grab, Ashanti. I'm sorry. But yeah, what was I saying, y'all? Look, I got sidetracked.
Well,
Somebody, I
I
know
asked
that's
what
what
an
gets you
abnormal
wrong.
pap smear.
Oh yeah,
Abnormal
yeah, yeah,
caps.
yeah.
Why would it
So
be
like any type of
abnormal?
inflammation can cause like ascus, but when you start getting into like because there's a lot of things. There could be just ascus, and then HPV can be negative.
Uh-huh.
Um, and then you can have ascus with HPV. That's something. And then you get into like low grade. We call it L seal for short. Then there's H seal, and then there's like steps after that are like basically like precancerous early stages of cancer that you get into after that. But just the ascus part alone, like just inflammation, an infection, recent sexual activity can cause that. But when you start hearing the word HPV, HPV is human papillomavirus. That is the virus that can cause cervical cancer. But that eventually can cause more changes than just the inflammatory response. It can start to progress. But HPV is typically what causes your more advanced abnormalities. Is the presence of HPV, which you're exposed to through sexual contact.
See, so ladies, we learned it here. Let's not have sex if you know your pap is the next day.
It's the next day.
It could help out.
Yes.
I mean, I'm just saying it could help.
Like 72 hours, like 48, 72 hours before,
2 days or 3 days.
Yes.
I got you.
2 to 3 days before, don't. Or ladies, if you have something going on, like, remember what I said early on, I don't want you to douche ever. Like, you shouldn't ever douche. But especially if you have something going on, you're like, there's some discharge or something going on, don't go in there and wipe it out before you come to me. Like, I need to see that. Like, as gross. Some people, obviously, take a bath, like wash up, but don't go in there and try to
disrespectful.
like just exactly. But don't go in there and just like wipe it all out. I've had patients come in, they're like, I've had this discharge, and I'm like, I don't see anything. They're like, I went in there and I cleaned it out. Like, what am I supposed to look at? How am I supposed to? Because some things we can tell you that day when you're there. We can do what's called a wet mount, where we get a swab of the discharge, put it on the slide, and look at it under the microscope. I get to use my biology degree every day, but but sometimes we can look at it right there, but we can't if there's nothing there, or if you're on your period. Remember that. That's the other key point. Like, if you're on your period, we can't do your pap smear, like your annual. You'll need to reschedule, not on your period. But say like you want to do STD testing, we can still do that while you're on your period. But
I didn't know that. Okay.
Yeah, because it's mainly blood work, ain't it? STD testing and
chlamydia, gonorrhea, trick, we can still do that through a swab. They can still detect that even with the presence of blood. But that's usually a swab or urine, so we can still do that through that. But like your HIV, hepatitis, and syphilis tests and stuff, that's through blood.
Okay. That sound like the ones that can't be, well, HIV can't, you need to know immediately.
Yeah.
So,
I get my I definitely every year when I do
me too. And I know that's
I do the blood work.
Controversy. I don't know if it's controversy or whatever, but being married, sometimes people are like, I don't get STD tested. I still do. I feel like it's necessary. I don't know. But to each his own.
There's other things you could be exposed to. It may not be. What if you got poked with a needle or something? I don't know. Like.
Oh, that's true.
Nah, I ain't around needles, so I'm just saying.
What if you got poked with something?
Well, okay, but listen to this though. So I was listening to Cocktails podcast, and they do what's called weird sex. And this lady said she went to, because stuff be happening, weird stuff be happening out here. So the lady went to the doctor, and she was like, on my side, like it's a little night on my side has been really sore. And she was like, have you bumped anything? She was like, no. And they looked at it and examined it, and it looked like she was stuck by a needle. And she said this guy at the grocery store had like bumped into her. And when he bumped into her, he purposely bumped into her, but he stuck her with a needle and injected his semen in her butt cheek.
Whoa.
Yeah.
Idiots.
That's gross.
Yeah. He sure did. He purposely, like, somebody bump into you, be like, okay, excuse me, like he purposely did it and injected his semen into her butt cheek.
That's gross.
That is. It's very.
So
people are weird.
Needles are out here in the streets.
Yeah. All right.
I'm just saying. That's what I know. That's what I said. I had never heard of such thing. Like, so now I be watching. I'm like, make sure nobody bump into me. What's in your hand? Cause and for you to put your semen in a syringe and like put it and get ready to go 6 Like that's just a bit much. But he did.
Yeah, that's gross.
Yeah.
Tracy, before I want to ask about your organization, but I wanted to ask one more question
Yes.
about how do you, if you have pain during sex, how do you know if it's something wrong?
Um. So there's different types of pain with sex. So like if it's pain upon insertion, a lot of the times that has to do with like you're not ready or you're not well lubricated. So I always tell people, you can't go from 0 to 100 real quick. You know what I'm saying? Like he's gotta
Right.
he's gotta warm you up, like help me out a little bit. The foreplay is very important because that helps increase
Mm.
blood flow to the vaginal area, that helps your tissue expand in the vagina, that helps encourage your body to produce lubrication. If he just like goes for the kill, like, okay, yeah, that's gonna hurt. Or let's say even if you don't go for the kill, y'all are doing foreplay and it hurts at the insertion site. It could be an issue of dryness. Sometimes women may be embarrassed to do it, but you may have to incorporate lubrication, especially as we get older. Our hormones aren't the same as they were when we were younger, so you may notice like you were more well lubricated in your 20s, and when you get in your 40s, 50s, hormones start to change. It's not like that
Mm-hmm.
anymore. So you may have to instill a little help of some lubrication, like if you're using condoms, a water-based lubricant, because you don't want to use oil-based because that could burst the condom. But if
Oh.
you're not using condoms, silicone-based lubrication is amazing. A little bit goes a long way with silicone based. You typically have to go to like a specialty store to get those, like like your Starships and places like that. But yeah, that's good for that. But deeper pain with deep sex, if your partner is very well endowed, it could be just size. You may have to at that point do work and do different positions like that, put you in control so that you can control the depth and the speed and everything. So you may have to do something like that. Um, but say like there's pain, you're noticing bleeding after sex, you notice there's a weird discharge along with the pain, um, come in and see me because we need to do some tests, because sometimes that could be a sign of an infection. If it's painful and you're noticing a discharge or bleeding, um, some people say like they notice like they just bleed after sex, come in because there's anatomical things that could be going on the surface of your cervix, or within your uterus, that we need to take a look at. Sometimes that could be a sign of early stages of cervical cancer. Say, like I had a patient one time. Every time after she had sex, she would have this bright red bleeding, and she came in and we I did like tests. We did a pap smear, came back a slightly abnormal, but I looked the year before her pap smear was abnormal as well. And sometimes you have to make clinical judgments, like I know the guidelines don't say this patient needs this, but I feel like she needs a little bit more in-depth look. And she had cervical cancer. She had full-blown cervical cancer. And that was the sign. Was the bleeding with sex. That was the only thing that she had going on. And it was so weird that I found out, because I never knew. Sometimes I'll see patients, then I refer them out when they need more further evaluation. I have to refer them out to the doctor. So I never saw her after that. I was getting my car fixed one day, and I dropped it off before I went to work. And when I got in the Uber, she was taking me to work, and she was like, Southside. She was like, I used to go there. She was like, it was a provider there. She helped me figure out that I had cervical cancer. She saved my life. I was like, that was me. And it was just so great that I was like, I felt like I
Oh.
made a
Yes.
difference. I was like, oh, that makes me feel good.
Yeah.
But but yeah.
Yeah.
So like bleeding or discharge, or just say like the pain is just not going away. Come see your provider. Come see me. Go see your provider, and we can dig a little further, because sometimes that could be a sign you could have a cyst, you could have fibroids. There's a lot of
That was the
things that could be
question.
going on.
Difference
I
between
had.
cysts and fibroids.
Yeah, I had cysts. I have had a couple of. I have cysts all the time, and I still got. That was partially the reason why I had my hysterectomy. But
Hysterectomy.
so I have a cyst, and I still have a cyst right now. Sometimes it's complex, and they want to take it out, and I'm like, look, I don't want to. Because my
Yeah.
doctor before he was like, oh, let's take the other ovary. I was like, no, no, no. I don't want to be in full blown menopause. Like I'm too young for
Yeah.
that.
It
Like
will do that to you. Full
let's
blown.
just see what happens. And then it went back to a simple cyst. And sometimes it just kind of be back and forth, back and forth.
Yeah.
So
Yeah.
I know that's the thing that I have is definitely a cyst on
So
my
it's the
ovaries.
difference between cyst and fibroids is cyst on your ovaries and fibroids on your uterus.
Mm-hmm. Yeah.
That's science. Go
Yeah.
ahead.
Tiffany, you a doctor, ain't it? She a
You
doctor.
got
I
it.
think
You
she.
got it.
Oh,
Yeah, we could definitely go on and
yes,
on and
yes,
on. It's
yes.
so because we are
We
three
can do a
women and
part
we
two.
like
This is fun. Let's
we okay.
Part
invite
two.
me back, guys. Look, I'm inviting myself back. Okay,
Yes,
I'm coming back.
absolutely.
Yes. So we Tiffany, you introduced the organization that she currently has. The
Tracy, tell us about your organization. I know you gave us your journey with breast cancer,
Yes.
but I know you and a friend in Atlanta,
Yes.
Is it Aston?
Aston.
Okay, I got it
We
right.
so we have a nonprofit organization called I Can Survive Retreat. So it is a retreat for any type of cancer survivor, not just breast cancer, but any type of cancer. But we haven't had. We were gonna have our inaugural event a few months ago, but with COVID and everything going on, people are nervous with traveling. And then this Delta variant, and then this other variant that's coming out. So we just decided to postpone it until everything calms down. But it's a retreat for cancer survivors, anyone that may have been affected by cancer. So if you were like a friend of someone who went through cancer, or you can come, or survive, a family member, if you are a caregiver for someone, because it's a journey, going through cancer. It takes a village. It's not just the person. You have your loved ones, your spouse, your children. So it's just, it hits different when you have someone that you can talk to about your journey. Like I was telling Ashanti when she was talking about your grandma, like it's so great to be able to talk to someone who went through the same thing as you, or to hear someone's story. It's so empowering to hear someone else's story of their triumph, how that came through on the other side. Like how you meet friends and how y'all click because you have something in common. It's
yeah.
like you click with somebody because y'all experience the same thing together. Um
Okay.
so it's just nice, and it's a way to just relax, bond, get some new information, because ultimately, no one wants to go through that again. So it's like, what are you doing on your health journey to keep yourself
Right.
going? So all of that. So we want to provide a space for that for people. So as soon as
Oh.
everything gets better, we will be on an island or on a beach somewhere living it up. So
I
Okay.
love it.
yes.
I love it.
And where can they donate to your
We
organization?
have
Where
a
can they find you
website,
all?
I Can Survive Retreat. Uh, .com that you can go to. We have a link where you can make donations. You can go to our Instagram page, I Can Survive Retreat, and it's cancer, not I Can Survive. It's cancer, ICANCER, Vive, VIVE, Retreat. It's on Instagram. You can follow myself. I have the link in my bio as well. I am Treecie, TREECIE, on Instagram, and Aston's name is Love Aston, LOVEASTIN. But yes, please check us out. Like I said, we are accepting donations. Those donations will go to excursions and things that we want to provide on the retreat. So, or if
Oh.
we get enough money, we could pay for people stay. So we could also do that as well.
Okay, that's really good. Definitely we'll have the information here on the screen for y'all so y'all can see where to reach out and where to put your donations. Definitely to help someone, send them away because this is much needed for people who kind of going through, who survive. A celebration and also a getaway from someone who may be currently experiencing,
Exactly.
something at that time.
Yeah,
So
it's not just
definitely
for
something.
survivors. At any point throughout your journey, we have people called previvors. Like, so let's say you had genetic testing, you found out you were a carrier of BRCA1 or 2, and you decided you wanted to get a mastectomy. Um, anyone is welcome. Anyone.
Okay.
Yeah.
Oh, okay. Thank you for that information.
Yes.
So now we have our soul food. Y'all already know we like to leave y'all with something to feed your soul for the week. So Tiffany, what is the soul food for the week?
So I battled with a couple of soul foods for this week, but I'm excited. We talked a little bit about women's health and starting to talk about breast cancer because October is Breast Cancer Awareness Month. So, but soul food for this month or week, rather, not month, is it's okay to feel other emotions besides happiness. It's okay to feel other emotions besides happiness. So, that is what I had for this week. So
Tiffany, you've been coming through with the
He does.
with the
Like,
soul food.
yeah, yes. My favorite was
Yes.
that hot girl summer. I was like, yes, that's soul food on there. I like that.
yes, I love
Yes,
it.
she come through with the soul food.
Yes, I like it.
Uh, yeah, so y'all, we're gonna wrap our show up, and it's two things that we want you to do when you're listening to Not Just Girl Talk. Number one is refill your cup.
And vibe with Tiffany and Ashanti.